Even though they look like any ordinary dogs, you might not know that they have an important task every week. Their job as part of the St. John Ambulance Therapy Dog Program is to make weekly visits to a number of different places such as hospitals, senior homes, and schools to help individuals release some stress, anxiety, to boost their spirits overall, and to get lots of love.
If you pet a dog for more than 3 minutes, your stress hormone cortisol goes down and your oxytocin or bonding hormone goes up. So we've seen people, as I said, their stress really goes away. And in the nursing home, I've seen, Alzheimer's people, residents that are very agitated. They're petting a dog and they just calm down, their breathing calms down, their blood pressure and everything goes down.
An article published by the Journal of Psychosomatics not only confirmed these results, but also mentioned that they worked a lot faster than many drugs taken for stress and worked only after 5 to 25 minutes after interacting with a dog. And it all started in 1992 as a pilot program in Peterborough, Ontario. Since then, there has been such a positive response that now there are over 3,000 therapy dog teams that visit thousands of people Canada-wide. Like Andrea Parsons, who has been with the program for 6 years and is one of the many volunteers that has seen the changes it makes in people's lives.
I didn't realize the effect on some of the residents until some of the staff had said some things. So I had one woman, I used to call her the giggler, because every time we'd walk into the room, she would just giggle the whole time. And I found out that she wasn't like that when she was kind of an unhappy person. And for that moment, she was happy, and her laugh was contagious, and it made me laugh. And so it felt good that I could do that for her.
And it's the same for Wavy Granger and her dog Sassy, who even though they have only been with the program a short period of time, they have been making a difference at University Gates Long-Term Care Center.
Well, we're told to get out of our comfort zone, right? And once you do it, it's such a good feeling. People need to do it more,
But despite the fact that the program has helped thousands of people, for the volunteers, it can be a challenge sometimes, especially when a resident passes.
I got to experience it from the other end too, because 3 years ago when my mom was, she was dying of cancer, and she was on the cancer floor. They had a palliative care room, and the doctor that was in charge of the oncology doctor, she had a St. John Ambulance Therapy dog. And I'm saying we were in New Brunswick. That's where I'm from. And both my twin sister and I, we were away from our dogs. She had a St. John Ambulance Therapy dog. So when every morning she came in doing rounds, she left the dog with us. And it was, as I said, Mom was beyond, at that point, helping, but it helped us.
It was hard because you get such a rapport with these people. You might not be spending tons of time with them, but the time that you are spending is quality time.
You kind of know going in to try not to get attached to people because you don't know how long they're going to stay. But sometimes it's hard not to.
However, the benefits to the patients and their family far outweigh the difficult emotions the volunteers can sometimes experience.
It's not an upsetting thing. It's a privilege to be there for them during that time and to be there with the family members.
And like she says, it's a good feeling to know that she has been able to provide some comfort during their stay, which is something Wavy and Sassy will be experiencing more of as she passes her probation visits and becomes a full member of the St. John Ambulance Therapy Dog Program. For Spoke TV, I'm Carmen Ponciano.